I agree that the world we live in today has changed drastically, and we are witnessing daily greater suffering, greater polarization, greater suspicion for international collaboration, and ever receding global solidarity. And my view is that science in general and global health more specifically finds itself in a moment of great precarity and an existential crisis we've never witnessed before, at a time when the fruits of scientific advancement are ripe for all to enjoy. The receding trust in science and the decline in global solidarity means that fewer and fewer people can benefit from these advances. And sadly, the most vulnerable populations remain the most exposed, even if their locations often serve as sites of knowledge production for advancement of global health that improves health outcomes for all. So to achieve solidarity, the pursuit of equity, social justice, and health justice must be at the center of all global health efforts. And real partnership will be key to achieving these laudable goals. So what can we as funders do? And I have five brief points to make. Much too often, international donors and funding organizations who come as saviors prefer to fund projects that address their own interests on their own terms and with onerous reporting. This in turn leads to wasting of resources, often lack of local buy-in, and loss of local research interest. And importantly, a loss of trust between funders and those who want to make a difference. And even when the research and implementation work is focused entirely on low and middle income countries, much of donor funds are given to agencies and institutions in high income countries who hold the purse strings and by extension, the power. So this needs to change. And in building solidarity, therefore, first, high income countries must be willing to yield some power if we are to grow more equitable global health networks that can foster a more equitable world. In the pursuit of equity, social justice, and health justice are key. And if we are trying to achieve these, we need to address the intersecting systems of privilege and supremacy that continue to limit our ability to achieve such equity and justice. And it's important to keep in mind that inequities are not only about the needs and concerns of the disadvantaged, but also the systems that create and perpetuate these disadvantages. And funders need to recognize that the current structures in global health benefit high-income countries, even when that work of science is completed in the global south, a collective I prefer to refer to as the global majority that is home to 80% of the world's population, and on whose back the careers, the status, and prestige of many global health actors, the scientists among them often rise. So two, those of us who have a voice in global health should collectively affirm our ownership of the field. The global majority, I feel, need to claim the space in global health that belongs to them and is proportional to the size of their populations, the size of their knowledge, and the size of their problems. We need to convert the opportunities we see into opportunities we can gain, weaving networks of solidarity with peers and building collaborations across the global majority, without necessarily dismantling North-South partnerships. In many settings in Africa, for instance, universities and research institutes are much more likely to have high-income country than in-country or in-continent collaborators, which are essential for solidarity and learning across regions and countries. And so funders can play a really key role in enabling these partnerships amongst those within the global majority. And within all communities, there's also a need to engage and foreground the voices of women, frontline workers, and people with lived experience, since they are often invisible in national consultations and committees. Three, low and middle income country governments and institutions need to invest more in their own healthcare delivery, their own health research, and their own health training to reduce their dependence on high-income country donors and philanthropies. And this will ensure that funding is better aligned with national priorities. In situations as we have witnessed recently, where countries like America can weaponize programmatic global health funding due to their substantial influence, resulting in instantaneous loss of livelihoods, care, and lives for millions world over should never exist. Therefore, building quality research and teaching institutions in the global majority is critical to reduce reliance on high-income countries to improve the overall quality, depth, and relevance of scientific training, research, and conduct. And fourth, we need to build solidarity by keeping the focus solely on pathways to impact the reduction of inequities. As funders, we can influence how the academy incentivizes research. And much of global health was conducted through universities and similar research entities. And I witnessed what I see to be a major problem that academics are incentivized to focus primarily on personal development, issues in tenure, personal awards, publications, impact factors, prestige of grants, often at the expense of real impact. Universities and academic institutes involved in global health need to be held accountable by funders for creating structures and processes that incentivize academics to be better allies, giving credit to high-income countries and other privileged global majority colleagues for supporting allyship work and power sharing, and to be responsive decision makers on the ground, engaging with organic local processes and indigenous knowledge. And then finally, the funders need to work with local communities in the co-creation of scientific goals so that the science is responsible, and most importantly, is relevant. These relationships must be predicated on trust, on mutual respect, and clear communication of roles and expectations. And in thinking about the loss of solidarity, funding agencies, particularly those in the global majority, need to focus on how they build their own agency rather than building new dependencies that may leave them in a similar position in the future. I'll stop there. Thank you.